There are basically three types of hypertension: primary, secondary, and complicated primary hypertension. Is the one that affects most adults but has no identified cause. 95% of hypertension cases are primary hypertension. This type of hypertension is called primary hypertension or essential hypertension. Tends to develop gradually over years. Secondary hypertension is another type of hypertension which accounts for about 5% of adult cases and is caused by an underlying condition such as renal disease, adrenal gland disorders, sleep apnea syndromes, congenital health defects, or endocrine disorders. Certain medications and illegal drugs can also cause this type of hypertension, called secondary hypertension. This tends to appear suddenly or manifest as a stable blood pressure that becomes liable. Patients that have secondary hypertension tend to be 30 years of age or younger and might not have any family history of hypertension. Secondary hypertension patients tend to have higher blood pressure levels than a patient with primary hypertension. And hypertensive medications tend to have little effect unless dosage are increased or combined with other medications. Complicated hypertension can occur when a patient is pregnant and can be a serious health condition. A spectrum of hypertension disorders can occur in pregnancy. Gestational hypertension or preeclampsia are two complicated hypertensions that can occur when a woman is pregnant. It's something that can be serious. High blood pressure occurs when the force of blood pressure is pushing through the arterial walls. It is consistently too high, making the heart work harder to pump blood. Since you have been diagnosed with the hypertension, it is important to know your risk factors. A family health history is one risk factor, and since you have your mother and father that have hypertension, that puts you at a high risk. You're most likely to develop high blood pressure if your parents or siblings um, has this condition. Obesity is another risk factor that can contribute to high blood pressure. So the increase of 20 pounds and a lack of exercise can put you at a higher risk. Race plays a factor in high blood pressure. Hypertension is more prevalent in blacks. The history of smoking is another risk factor that can contribute to hypertension. So it is great that you have stopped smoking. But drinking a lot of beer every day does not help with high alcohol content, which can be another high risk factor of hypertension. A diet high in sodium, fat, and carbohydrates is an indicator of a poor diet, which is another risk factor. Having hypertension is manageable with diet and exercise, when needed, medication. But if left uncontrolled, it can lead to a heart attack or stroke. Hardening and thickening of the arteries due to high blood pressure or other factors can lead to a heart attack, stroke, or other complications. Understanding your blood pressure levels is important. Getting regular doctor visits for checkups. People who have readings of 130 over 80 or higher on at least two occasions are said to have high blood pressure. Try to limit the amount of sodium intake. Follow a DASH diet, which is a diet that people with hypertension follow with less sodium. Start an exercise program. Even something simple like walking a few miles a day can help lower your blood pressure and contribute to you losing some weight as well. And continue to stay away from smoking and avoid alcohol if possible. This can help you control your hypertension or even reduce your blood pressure.